Welcome back, everyone, to Health Week. It is day 2 of our Health Week, our annual Health Week here on 1480 WHBC. Today we're at OMNI Orthopaedics on Belpar, and we've been talking about a lot of different things. We've been talking about surgeries. We've been talking about physical therapy. And now we're going to talk about non-surgical things, pain management. And we have with us Dr. Kelsey O'Connor, who is, I guess, what's your official title?
Well, it's kind of a hybrid. So I am non-surgical. So I always joke with my patients, I'll poke you with a needle, but I'll never actually cut you.
Okay, so not like Dr. Bickett who said knives,
no,
right?
I'm needles, not knives.
You're needles, not knives.
Which can be just as scary, I get. No, so I practice a really specialized active pain management approach. I use a lot of interventional spine procedures and injections coupled with therapy, movement, all in the goal of regaining or returning you to a more functional aspect of life. As we age, we have degenerative changes, and we start to lose kind of the ability to do things that at one point were completely normal and pain-free for us. My goal is to try to kind of get you on the right track, let that snowball by improving pain and function so that you can do pretty much what you want to do within a reasonable doubt. I mean, if you're 94, you're not going to be learning to play polo.
Right.
So,
Exactly.
Which is an example I just like to use. So,
well, when you talk about this, how do you decide or determine, or is it up to the patient to decide or determine whether or not, surgery is something or the things that you offer is something?
Yeah, it's kind of a multimodal approach. So I'm looking at your physical exam, which we do a really detailed exam when you come in. I'm looking at imaging or ordering advanced imaging. How does that correlate with what your pain patterns are, what your limitations are, what your goals are, and looking at previous treatments that you've tried in the past. Sometimes even after surgery, there can still be pains or issues that can use some guidance and focused treatments. So it's kind of a trial and error in some ways, and that we try some things and see how you do. And especially when we get involved with the spine, it's a very complex, multi-system part of our body. And so it's kind of a puzzle. It's about finding the biggest piece of what's generating that pain. What can I do to try to help immediately alleviate it? And then what do we do long term to keep it happy and healthy moving forward?
Yeah, talk about the spine, because each different section is different parts, right?
Absolutely. So I always explain the spine as you have kind of this highway of nerves in the center wrapped around by big, strong bones with discs and kind of cushions in between. And then that's all wrapped in tendons, muscles, and fascia. In small joints as well, to the big joints, to the discs, any one of those systems can start to have its own issues that can generate pain or limited ability to do, kind of functional tasks.
Yeah, I mean, I often hear of people losing that cushion in between the discs, right? And
yep.
Arthritis.
Arthritis is a big player. Degenerative changes in the discs, the small joints, and people and often even other physicians who aren't spine specialists underestimate the role that the muscle and the kind of spider webby fascia that kind of overlays all the muscles and lets everything glide together. There's a lot of emerging researching indicating that that's a huge player in your especially bread and butter low back pain and limited ability to do things like get up and stand up, garden, clean the house. When you start to get that pain with repetitive movement in your low back, it's a really quite complex issue. And it kind of takes a multimodal approach of different ways to think about it and treat it.
Lower back pain. Probably, I mean, anybody I ever talk to that says, I have my back hurts, it's always lower back. It seems like that's very popular.
Yeah, typically in the low back and the upper neck or the cervical region. We think that's because it has a lot to do with the physics of the curve of our spine, how we absorb forces. The neck has to hold up the weight of the head and the brain. The low back has to absorb force with the ability to walk, and how our pelvis has evolved to allow us to walk on 2 feet, which no other mammal does. And that's great, and we love that. But over time, the repetitive force can lead to that degenerative change that we see. Typically, we can start to see it in imaging on average 30, 35, 40 years old.
And how do the injections work when people get injections?
So there are different injections kind of tailored for what your symptoms, imaging, and kind of goals are. Most of them are steroid-based. So we have to kind of take that into account because steroids are great for pain and anti-inflammatory, but they also can have some side effects. So we have to kind of, be smart and somewhat conservative about how much and how often we're using those. But the goal is, I kind of tell it to my patients as, think about the injections as a reset, a Control-Alt-Delete for your pain signals going through that low back or neck pain. And once we kind of get that ball rolling, then that's where I really push the exercise, stretching, and muscle component, because that's what's going to continue to crosstalk and tell your body and your brain that, hey, things are good, we can do this stuff, we don't have to go into that flare-up or guarded pattern right away all the time.
Okay, and so it's not just pain relief, but it also then ends up being a treatment. Is that right?
Yeah. A lot of people think that the injections are just a short-term fix, and in some ways, it's. I understand why people think that, because I'm just going in, putting a dose of medication in, and then it will last there a week or two, and then it does get absorbed and excreted through the body. But the effects can be much longer if you understand that it's a tool to help get you moving. And really, by movement is where we see those long-lasting, happy and healthy kind of patterns.
Are there more extensive things beyond the injections, like a single injection? Or
Sure. So sometimes we do an injection to kind of figure out where the generators of pain are coming from, especially for low back pain caused by arthritis. And if that's beneficial, we see how long it lasts. And if it's helping but not giving you length of relief, we do a procedure called a radiofrequency ablation. And what we do is we have a special machine that we can hook our needles up to that actually heats up with radiofrequency waves. And it actually can burn or ablate the small part of the nerve that we know selectively carries those pain fibers to and from the low back. And with that, people can get 6 to 9 months conservatively. I've seen people often get years of relief of their low back pain with that.
Wow. Does it hurt?
We do give you a little bit of twilight sedation for that, but it's not terribly uncomfortable. Most of our procedures are really well tolerated. They're all done in our new state-of-the-art surgery center, Oasis, and typically we just use a local, and that really helps with recovery time and helps you kind of get back on your feet a lot quicker than if we did like a full sedation.
Do folks start with you, or do they, come to you after maybe they've talked to somebody else?
It varies. Usually. I see probably 50-50. I see people who are starting with me because they want to try the more conservative things first and the more active approach before they go into more invasive or talks about surgery. I see people after they've seen a spinal surgeon and the surgeon says, you have X, Y, and Z going on, but I'm not sure that it's a surgical issue yet. I would say let's try what we can do through our interventional spine docs here to keep you happy and healthy and functional. Some people may not be a candidate for surgery, for other health reasons, and that's where we come in as well.
Well, a lot of great information for folks who may be, shying away from even thinking about surgery or have been told they shouldn't have surgery.
Absolutely.
It's a great option, and we appreciate you. Dr. Kelsey O'Connor, thank you for coming by today.
Thank you. It's always a pleasure to talk with you.
All right, and we will come back in just a few minutes and wrap up our final segment here on Health Week at OMNI Orthopaedics right here on 1480 WHBC.